So after this launch, we have with us Mr. Puneet Bali, who is the Executive Director to the Smile Foundation, and they are doing quite a lot of healthcare activities along with other programs here in the Assam. So we would like to know about today's initiative that they have taken about the launch of the mobile vans in collaboration with MSD India. Welcome to Business Northeast, Mr. Puneet. So, give us a brief of Smile Foundation, what work they are doing here in Assam currently.
So Smile uh, works in the areas of health, education, skilling livelihoods, and women empowerment and disaster response. In Assam, our current work is spread across women empowerment, education, as well as health. In the past, we've done some work in disaster response and floods and all that when they happened. Our current work is primarily around health. We are in about 4 districts of Assam: Darang, Barpeta, Guwahati, and also now South Salamara. Across all these 3 districts, of the three, Barpetas and Darang have mobile vans. Uh, Guwahati also has a mobile van, and South Salamara has a mobile boat. In fact, it's a boat which we're running there. Um, Darang also has some education involvement, and one more district I forget has some NGOs locally which we've trained in education. So our overall work spans all these. Primary remains health. Health, not because of any other reason, but for the fact that last mile is very difficult for governments to achieve. Therefore, we run these mobile health units, and now the boat in the Brahmaputra to make sure that those ravines which remain uncovered by primary health centers and sub centers, they get covered by us. So primarily health work is happening in Assam right now.
Okay, so the transportation or the traveling across on roads are quite easier nowadays. That doesn't we can tackle the climatic conditions and everything here. But what about the the boat? We do have rains. All throughout the year, plus we do witness flash floods as well, and most of the river and the riverine places here, they are almost submerged underwater
Yes.
uh, during the rainy season. So how you are going to tackle them, like how to
So
provide them the facilities?
yeah, so that's an important question. What we've done is we've worked with the Joint Director Health at South Salamara, and based on their advice, we've identified places for OPDs. Now, the boat is parked at one place, but it goes to different locations. It covers all the islands there, and it parks at one place for one day and looks at patients. However, in case there is a movement of that because of floods, alternate locations have been identified. So if some uh, unnatural activity or a natural disaster happens, we have backups planned. To the kind of record keeping which is happening there, it's all on computers in our system, so that even if some of these people were to be displaced from there and taken elsewhere, the health records remain and work can go on. And the third part is to say that can we link them to existing government facilities which may not be on their ravine but somewhere on mainland. So in some cases we also plan to transport people with very severe deficiencies and problems into the mainland hospital. So those are the three ways which we are looking at addressing these issues. But primary to me is the support which the local health authorities there have given to us. They are very appreciative of the fact that we have local staff. Our nurses, ANM, GNM, and doctor are from that area only. They live within the community. They know and understand the primary problems that the community faces. They can talk to the community in the same language and track the medicine intake, because in a lot of cases what we see is it's not about detection of the disease, it's about continuance with the medication or the rehabilitation plan for a period of time. People after the first 3 days stop taking medicines. After the first 1 week, do not follow the rehabilitation plan. So that follow up is critical, which our staff is going to do. So I think there is a plan in place to address any calamities that may happen, but currently it's important to make sure that the most unreached parts are reached out to.
And how are you planning to appoint doctors, the staff entirely for those remote places of Assam?
So we already have staff. There is a large number of doctors who are uh, coming out of medical colleges as they get into their residentship training. We use some of them. In fact, some senior doctors who've retired from government positions, they want to come and give back to their communities. So we have them who are working here. both are doctors in the two vans that you met just now. One of them is a very senior doctor who's almost retired from his service and now wants to keep giving back to the society. On the boat, we have a very young MBBS doctor who's serving, and the doctor carries great confidence of the Joint Director Health also. Similar with these ANMs and GNMs, the nursing graduates, and the pharmacy experts. These are people from local communities that we're trying to hire. And uh, touchwood, I may say that we've managed to find good people from within the community. Yeah, the fact is that you've also got to train them, provide them the right kind of knowledge to be able to serve in those communities. So we've taken 3 to 4 weeks of extensive training on our existing projects in other places to train them and then bring them back here.
And also during the press briefing, that everyone said like you not just provide the healthcare facilities, you also aware the people about about diseases and when to take the medications, vaccinations. So are those people who train them are from your organization, or you
Yes.
hire the
So
locals?
there are two parts to it. One is you saw the person who heads health, Satnam Singh was here. So he runs the health unit. He has a team of people who can train. But health is a very, very vast field. So on the one hand, there is, let's talk about South Salamara for a minute. There is very strong incidence of skin problems because of the kind of terrain that they're in. Then there is lack of nutrition because you have very unitary focused meals or eating patterns there. And then there is musculoskeletal because people, well, whoever works there is either lifting weights or whatever, so the knees and ankles, they are under stress. Now you have very three different kinds of things that need to be approached, and one person can't do. So we have trainers which we've hired across. We have partnerships with various organizations who keep providing inputs to our ANMs, GNMs, and staff of these vans so that they can go and talk to these communities. See, the key is not about providing a solution for every problem. The key is about changing that health seeking behavior. If you go to any of these socially backward and poor communities, what you'll find is that the woman of the house, she's the last one to even report that she's unwell. They'll eat only leftovers, and even in 2025, it goes without saying. You forget socially backward communities, even the most developed communities, you'll find the woman of the house eating last in 95% of the cases. I'm not talking about the 5%
It's
poor
common
different.
in India.
It's very common practice, and what that means in these communities is that you'll get only the gravy of the dal itself, or if there's meat, you'll get only the gravy. What nutrition is it giving to you? And if you already have a condition like anemia or a TB which is growing within you, it's just going to get worse. So the whole idea is you provide medicine for that symptom that the doctor can see. So that part is managed by the medical or clinical intervention of it, or curative intervention of it. The other part, which to us is the more critical part, is you're going every day into the community. After the first 2 or 3 weeks, there's a lot of trust that gets built. Then you start to look at their health seeking behavior, the behavior where they have to stand up and say, I am not well, I need support here, whether it is for the woman herself or for her child or for the girl child or for the man of the family. So the whole idea is that these people need to be trained not just to advise them on what to do, but also to identify who has poor health seeking behavior and tell them you need to change this. And that alone Smile doesn't do. We have experts who we keep on our rolls at Delhi, in Bombay, in Calcutta, and we use them for different trainings at different points of time. So that's how we train this front end staff.
Okay. And since you mentioned like women of the family, they don't take care of their health.
Yes, I mean, I can tell you about my own family. My mother would do this. She's 80,
Mhm.
but she'll try to eat last. When you have to tell them, hey, listen, we are
Yeah.
fine. Why don't you eat first?
Yeah.
And if it's happening with me, I can guarantee you it's happening with
Everyone,
thousands and thousands
everyone.
of others. You can
So
appreciate that.
I will not just point out on the woman only particularly, but in backward, those places,
Mm.
like people generally they avoid going to doctors and they avoid, that they have these kind of health conditions. They ignore it.
Correct.
So how your team goes out and reach out to them and how they turn that thing into, that they are really taking your services.
So this is a huge challenge that the team faces. And if I tell you that today was a formal launch, okay, the boat has already been running for about a month now. The two vehicles that you saw at Darang and the Barpeta one, they've been running for almost 2 months now. But before they started running, that 2 months before they started running, the team was in place even 3 months before that. So before they start to go out, they go door to door to say that we'll start a vehicle, we'll start coming to you. What are your problems? So before the boat was launched, there was a team which went to at least 4 of the ravines to figure out what the big problems are, who are the opinion leaders in those communities also, because there are some people who, if they start to act in a particular way, others will follow. So mapping those people, mapping chronically ill households. So before the actual service is launched, these people go and map the community, and then it is the job of the community health officer, who is not a doctor but the leader of that unit of those 4 or 5 people, to go and walk the community every day. So if they're going and covering in 30 days, they're covering 15 communities. Sorry, if they're covering 2 communities a day and repeating after 15 days, so they're covering 30 communities. By the end of the second or third month, the person should know house by house what's the behavior problem, and then at the end of 6 months, from those, through further referrals, he should know the extended community also. So it is an integral part of the duty of the community health officer to go house to house to find out people who are not coming. So in some cases, there's a reluctance or resistance which is built in. Like in COVID, some people said we will not take vaccinations. So you had to tell them what's the necessity of a vaccination. In today's time, some people will just not say that I have a, someone spoke about, people will say, oh nahi, mere ko to diabetes hai hi nahi, I don't have BP. But if you go and measure, you'll find they have diabetes, they have BP. So they go door to door to check that, and every such van has health camps that they do within the community. So some of them may not come to even 50 steps here, so they will do a community health camp every 2 weeks, every 4 weeks, to make sure that they can go and find out and then draw those people out. So it's a highly people intensive and a community intensive job that they do.
And how you are providing the medicines and the other healthcare facilities to them? Like, what's the nominal fees that you take
No, so
from
there is no
people?
fee because there is no fee because all of that is getting funded by donors like MST. So it's absolutely free of cost for the community. However, if there's a referral made, then they have to go to the government hospital. So if someone is detected with, let's say, cancer and they referred to a government hospital, then they have to go and address that. We are also trying to see if we can get Ayushman cards made for as many people as possible, whoever remains uncovered, because that will take care of the out-of-pocket expenses of most of these people. But at our level, there's no charging of any fee for the service of information provision as well as medicine getting distributed.
And according to you, what's the success rate that you have got from covering the Barpeta district and Darang districts?
I think it's all work in progress right now, but at least the first 2 months of work at Barpeta and Darang and 1 month at South Salamara, I've been there last 2 3 days, and it's just a pleasure to see that there are people even before the boat goes and docks. There are people standing in a queue because they know that they have to take this medicine. So I'm hoping that 6 months from now, if we do a midline assessment to see has there been a change in the health, I'm hoping to see at least a 35 to 40% increase in the health patterns or parameters there. Yeah.
And since you have been doing so many community services here, what more we can expect from Smile? What next actually in your
So one
pipeline?
part, as I mentioned, is that we are working with a couple of large corporates in terms of providing STEM education in schools. So we look at districts where education outcomes have not been very strong, and at an early level, because if you look at the ASR report which has been brought out by Pratham Yaronia, children in the second standard can't count from 1 to 10 properly at a lot of schools, and children in the fifth standard, they cannot read or they cannot do math and English at the level of the second standard students. So they're 3 years behind what their actual thing is. So what we are doing is we've spoken with some corporates who've shown interest in working on this foundational literacy at the one level. Two, we're working with some large corporates in again Barpeta, Darang, and uh, Kamrup on on STEM education, along with making green campuses. So solar driven electronic smart classes in government schools is what we've already started to work on. We're doing that work in about 50 schools in Assam. We hope to reach out to more than 150 schools in the coming year or so. So education is the second bit. The third part is we work with paint companies. We work with Berger, for example, to train unskilled workers to become skilled painters, because then they can, again, given the kind of terrain and the weather that Assam has, people need to paint their houses, people need to paint their buildings and commercial establishments. So trained people can charge a little more. So this all falls within the upskilling domain, which even the National Skill Development Corporation recognizes. So currently we're working in these three. We hope to do more work in skilling and in education as we go forward here.
And what about the technology, since AI is been trending?
Yeah. So that forms a very critical part in every way of what we do. So AI in health, as I mentioned, to track the work of the vehicle at the back end, it's all now getting more integrated with AI. But insofar as education and skilling goes, at education, what we're working is now we've not launched that program yet in Assam because I don't have donors yet. But what we're working is sensitization of children in the second to fifth standard range on what what comes just before AI. So there's a design thinking, concept, uh, problem solving, and abstract thinking. Those three ideas we're working with small children on bringing into their curriculum. And insofar as skilling is concerned, working with students in engineering colleges to provide them not just Python and other coding, but basics of AI so that they can become more employable. That is already integrated in our programs, and we hope to take it further in Assam.
And that's quite impressive. And yeah, it was quite insightful to know more about the healthcare programs that you are going to run and how you are going to run this. And I wish you all the best for this
Thank you so much,
current
Indra's.
program.
Thank you.
Yeah, thank you for
Thank you.
joining today. Thank you.